Hi, Barbara Wally here, orthopedic and sports certified physical therapist, here to talk to you about red light therapy. So I got exposed to red light therapy when I was watching an episode of Hard Knocks. One of the football players was having a massage done and the entire room was illuminated with red light. And I was really curious about it because a lot of football players, especially at the NFL level, will use a lot of interesting therapies, anything to get a competitive edge. So I started to do some research on red light therapy and realized there may be some legitimacy to it. So let's talk about red light therapy. So it's low intensity and it's also red light. It's actually something you can get off of Amazon for pretty cheap, $50 to $100 or more, depending on the setup. But it's also known as photobiomodulation, and it's been marketed to improve wrinkles, redness of the skin, acne, and scars. So using it for a competitive edge with physical therapy, athletic training, and just sports in general is a pretty new concept. So where did it come from? So Andre Mester in 1967 in Budapest was one of the first ones to research red light therapy. He noticed that hair growth actually increased in rats as well as wound healing. So there was a little inkling of, maybe there's something going on here back in the 60s. And then NASA decided in 1993 that they were going to explore some different ways of growing plants under red light. And one of the interesting things that they came across growing these plants under red light is that any wounds or cuts or abrasions on their skin seemed to heal at a better rate than normal. So NASA in the 90s really started to pioneer the idea that red light could be used for healing, especially at a skin level. So looking at the preliminary studies of red light therapy, there's thought that it may reduce pain and inflammation. There may be an element of muscle recovery there too. It may improve athletic performance, may improve blood flow, it may improve on some level seasonal affective disorder. They've done lots of studies in areas with poorer climate where there's not a lot of sunlight that people in the more winter months can struggle with their mental health because they're not getting vitamin D and sunlight exposure. So there are some preliminary studies as far as that is concerned, but I'd like to make note there's not a lot of research or quality research to support the use of red light therapy with recovery, with physical therapy, athletic training. So use it with caution. So typically, and I really couldn't find a consistency here, you can use it daily, up to 2 to 3 times a day. And then other recommendations stated that you really need to skip a day. So you really need 1 day off in between treatments, but it's okay sometimes to go back to back. It's typically going to be 10 to 20 minute sessions under the red light. And I noticed a lot of people wear eye protection for their, to protect their eyes. So it's just one of those things that makes me curious and interested because I've always had a feeling that a lot of pain originates at the skin level. When you swell a lot, when you have a muscle strain, everything is connected. So I think the skin has a lot more receptors in a lot of areas in the body. So treating the skin may actually help with pain. So the jury's still out on this one, but it is a really interesting concept. And hey, for $50, $100, if you want to try it, it's relatively low risk. So I hope this has been very informative and I hope you have a great day. Thank you.